Hello, this is Optimum Health For All. I'm your host, Oji Oje.
Optimum Health For All, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all.
Today I'm going to do what I've not done before on this program. This program, you understand, I've been talking to health professionals generally and using that opportunity to talk about various issues relating to the health of the people and how these areas and benefit from some of the medical education topics that are discussed by the health professionals. But today, I want to talk to the general public. I'm taking a random sample, two people representing our viewers that will talk to us about the health program in our country. And they would would like to hear from them what they think about health resources, the facilities, what they benefit from going to most of our health institutions. Today I have a young lady and a young gentleman, and I would like them to quickly introduce themselves.
My name is Adaobi and Kelechi.
Thank you. Adaobi, what do you do?
I'm a photographer.
Okay.
My name is Kelechi Clifford. I am a broadcast journalist and also I am currently a student of chiropractic medicine.
Very good. So you practice alternative medicine.
Yes, sir.
Let's start with Adaobi. What do you think of the health facilities in this country generally, as general view? For example, if you are ill, would you like to go to any of our hospitals? Would you prefer to go to a private hospital or a public hospital?
Thank you very much for having me on the show, first off. So, personally, I believe I would normally go to a private hospital because I feel like, or I know that in a private hospital it's easier and faster to get a one-on-one with a medical doctor compared to a general hospital. And in a private hospital, the nurses are more polite and welcoming. So I feel like in the general hospital, the staffs, the doctors, the nurses are overwhelmed because they have more patients than they can handle, especially because they are really, really professional. Like, they are very good at the healthcare they give. They are actually very good at it. But they have more patients than they can handle, so they are already irritated by the time you get there. Maybe a nurse must have worked 2 shifts, no time to rest. So when you approach the nurse, the person is already very angry, and it applies to the doctor too. Doctors are less angry, but they are in a hurry, because they have a lot of patients they need to.
So, in summary, you would like to go to a general hospital a private hospital, because you are like to get personalized care in a private hospital.
Yes.
Supposing you go to a general hospital and you also get personalized care, do you prefer to go to a private hospital?
Yes, if I would get the same service as I'm getting in a private hospital. Yes, because it's obviously cheaper to go to a public hospital, a general hospital. So yes.
What do you think, Kelechi?
Okay, so for me, I just want to tilt towards what Adaobi has been saying. The public hospital cannot really be compared to private hospital because of how cheap, how easy the access between you and nurses and doctors. Like, they have this personalized relationship between you and them, and there is a shorter waiting time because it's private hospital. Not many people can afford it, so you queuing up for long hours is going to be very, very short. And of course, the hygiene level is also good. So hygiene level is very, very important when it comes to hospital. Most of the public hospitals that we see, some of them, the beds are not in good condition, the toilets are in poor condition. So you barely see this kind of things in private hospitals. And so the hygiene of you as a person is more important, or as important as the healthcare you're looking for in any of these hospitals. So that's why I would want to go to a private hospital than a public hospital.
Okay, so you are saying that basically is the overpopulation, the number of clients that go to general hospitals or public hospitals, that is responsible for these, as you said, the health personnel being overwhelmed, cleaning, for example, attending to patients, medical records, and then the attitude of the nurses and the doctors. It's a attitude that you really may not like. But of course, the general and the private hospitals are expensive, and more expensive than the general hospitals. So if you don't have as much money, you still want to go to public hospital.
If that's the option, you still will. Yes. But there's something I'd also like to say about the public hospital. When it comes to quality healthcare, let me put it this way. You know that saying where you have gone from pastor to pastor, in quotes. So when you have gone from hospital, one private hospital to the other, in the public hospital, you are sure to get that professional that will handle your case. So in the public hospital, the general hospital, it's really one doctor doing all the aspects.
Almost everything. But sometimes they invite other doctors.
Yes, all the aspects of medicine. So, but in the private hospital,
Yeah.
no, the private hospital is one doctor covering almost everything. But in the public hospital, you're likely to get a specialized doctor. That's what specialized doctor.
Okay, so the public hospital is still preferable overall. If you don't have this time, long waiting time, poor attitude of the health personnel and so on, you will still have quality care in the general hospital, in the public hospital, isn't it?
I really don't appreciate the health care from the public
Okay.
hospital because the like from my own experience now, when I had my son, I had to go to a health center to do
Phototherapy,
for him because he had jaundice.
jaundice, mental
Yes.
jaundice.
Yes, so I didn't like
The experience with
Yes.
that, yes.
they were not patient with the mothers. These are new mothers, some of them very inexperienced, so there was no place for them to live with their toddlers, so there was no provision for that. And some of these mothers had cesarean section, so it was really, really very uncomfortable.
So how do you think this can be improved?
It boils down to funding from the government and probably companies, private individuals that can also support this mission, like the way Shell is doing, for example. I don't know if other companies do it. They support LNG as well. They support the health.
The public
Health
health
sector.
sector.
Yes. So I
to provide personalizing it,
yes,
provide drugs in selected places,
yes,
maybe in the areas of operation.
yes. Yes.
So you are saying that government should pay particular attention, that private organizations can chip in so that for the benefit of the people in general, and the highest, because even if you have the funding, the attitude of the health personnel, how do you think that will change?
Okay, I believe if some of these complaints are channeled to the public hospitals because it's good to have customer feedback from clients. So if they read and pay attention to not just funding the public health, the public hospitals and facilities, but also reading complaints from clients complaining about nurses not having attention, nurses behaving somehow, then they can actually work on that. And I believe there can be trainings on character, on customer care services for some of these workers, and I believe that will improve them.
Okay. Is it also possible to have evaluation, client evaluation forms, so that maybe once in a week or once a month or whatever, you can give such forms to the client, that the patients, to evaluate each and every one of the healthcare provider in the public hospitals, so that they know that there's going to be feedback. If they have that kind of feedback, government has that kind of feedback, then it's possible that they can train these health professionals better on interpersonal relationships and so on, make them better able to cope with their work and their services, and maybe employ more people if that is the problem that they are overwhelmed and all that. So they need training, they need evaluation, and they need feedback. So we'll move on to another aspect of my inquiry, interview, discussion with you this morning. That is the value of a teaching hospital. You know that, let's say, most of the states in this country, you have teaching hospitals. Now, these teaching hospitals are supposed to be specialized in such a way that you have every subspecialty of medicine there, so that, like you said before, any qualified people and this teaching hospitals. Sometimes they are not accessible because you may need them and you have to be referred. So, what do you think about the referral system from either private hospital to teaching hospital, or from general hospital to teaching hospital? How do you see this referral system? How does it work?
I've often heard that this hospital rejects patients, and I believe it's because the professional for that case oftentimes is not available, or they're actually too busy. For example, in the government hospital, so let's say the heart surgeon in UPTH might still be the heart surgeon in BMH, and he will still be the heart surgeon in military hospital. You understand? So you don't know where the particular doctor.
So he works in many hospitals.
Yes. So I also think, I don't know if this might be digressing, that the government should create an avenue to sponsor people that want to be medically trained, as in that want to do that line of, because to study medicine is not easy because of the financial education and all of that. So I feel like if there are individuals that are willing, but don't have the sponsorship to read this medicine, as this medically inclined courses, if the government or companies actually can sponsor, this is not general scholarship per se. The way I heard in the US, I've not been there. They are military. If you want to become a doctor, you have to be in the military, and they train you, to be a doctor or a nurse.
So you are saying that government should be intentional.
Yes.
To get people, train them,
Yes.
to serve the country.
Mhm.
Well, I can say that government actually is intentional. It may not be free for everybody, but at least most of the training for doctors, nurses, generally subsidized by government, because it's not what they pay as school fees. It's not the actual cost of training. So there's some bit of subsidy, but not quite a lot of subsidy when we're talking about training doctors, nurses, radiographers, all those persons who work in the health team. There's quite a bit of subsidy government boosts in their training. But I can agree with you that despite that subsidy, there are people who can still not afford to get to pay the whatever fees are required for training. So we are saying that government will be more intentional in selecting people who are willing to work and therefore train them. I haven't trained them, I have an obligation to serve the country. All right. So that is one way of looking at it. Now the other thing I want to ask is what I asked before, the referral system. It doesn't work well. Like that's the way I read it, that doesn't really work well. So you still need to find a way of getting yourself to the best center. It's not that there is a referral one. If you take that referral to the hospital, you will not be attended to. That's what I'm saying. All right. So that is what I think the government can look into. The health authorities can look into it and say that referrals are seamless and are very efficient. Getting one from one level of care to another level of care. So I will ask a final question, what do you think about health insurance in this country? Or free health service, for example. If you were to go to hospital and you're not supposed to pay, whether private or public, and you don't pay from your pocket, would that not be a good idea?
It's going to be a fantastic idea. I mean, if you look at the Western world, they have insurances, car insurance, health insurance, and so many of that. But I don't think, even if we do have that here, I don't think many people are buying into that health insurance in this part of the world. And it would be really good if there is anything like that, and people become aware that there is something called a health insurance that can cover for some of their health issues. And so if we start creating the awareness about health insurance and telling citizens about it, and people become interested in it, then I believe it's going to save a whole lot and it's going to help Nigerians. I believe that health insurance is something that we should start practicing in this part of the world.
What do you think of that?
I think we really do need health insurance because as a poor Nigerian,
An average
no, I'm not an average Nigerian in this case. As a poor Nigerian, I would love the health insurance because there are often times I know that you have malaria but you don't have cash on you, but you really need to save doctor. So I also think that companies, institutions, especially for the government institutions, can have like a particular percentage that can be deducted from salary or added, because salary is already small, like added to salaries that would just do the medical bills, maybe like 2% of whatever is being earned.
So there should be a way
yes,
of paying for, because nothing is actually free.
of course.
So when you go, there's a cost attached to it.
Yes.
So we are saying that there should be some arrangement where either we has to pay a premium maybe once a year, or there's a tax, a levy
Yes.
on health, so that whenever you are ill, government can use that pool of money to treat us without necessarily paying out of your pocket at the point of service.
Yes.
Okay, so that's recommended, and I think government will look into it, or is beginning to look into health insurance. So health insurance is vital for the health of the people, and the more we buy into it, both from the government and the sub-national, that is the federal government and the sub-national levels, I think the earlier we buy into this, the better, and expand it to a variety of people. So thank you very much for that. Do you have any advice for health practitioners, governments, anybody to make sure that our health service improves?
Okay, so I think I have one based on the Japa syndrome. So I know a nurse that we graduated about almost the same time, and she immediately after her youth service, she left the country because she believes that there is a better opportunity outside of Nigeria, and it applies to a whole lot of you know, medical inclined people. So once they have saved up a particular amount of money, they just leave the country. So I feel like the government should make the country more um more conducive for these professionals to see, because we need them. An average Nigerian cannot travel abroad to get good medical care, and the doctors that are supposed to even take care of us here has also left to go over there. So they need to make the place really conducive for our medical professionals.
Okay. I would say the medical practitioners should first prioritize caring for people before money. I know that yes, they need the money. Sometimes there are cases of people losing their lives because the doctors won't attend to them because they don't have money. They have to put in something, deposit something. So I believe they should find a way of caring for people before exactly. So before they think of the money, and that would really help a whole lot.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Power is the machine, got the vision on deck. Cut the stress, no mess, keep the wellness in check. And we thrive, we shine with every routine. Optimum health, you know what I mean. Optimum health for all.